Radiation-induced coronary artery disease (RICAD) is an important long-term sequelae of radiotherapy to the chest region. The most common conditions associated with RICAD are breast cancer and Hodgkin's lymphoma. The risk is higher in Hodgkin's lymphoma because they receive a higher dose of radiotherapy. It may be noted that radiation is used in the treatment of about 50% of cancers, hence the importance of RICAD. Radiation causes vascular endothelial injury. It initiates and accelerates atherosclerosis. Pro-inflammatory cytokines were increased in the blood of long-term survivors of atomic bomb, suggesting a systemic inflammatory state. Even though RICAD is generally more common in older patients, younger patients have also been reported. One 30-year-old male with radiation 15 years prior had total occlusion of proximal left anterior descending coronary artery and 90% stenosis of proximal right coronary artery. Emergency angioplasty with stenting was done. Another 31-year-old female with radiation 8 years prior had left ventricular dysfunction, ejection fraction 35%, and 99% proximal left main coronary artery stenosis. She underwent successful coronary artery bypass grafting. A third person was a 25-year-old male who had radiation for spinal tumor 9 years prior. He had left ventricular dysfunction, moderate aortic regurgitation, severe calcification of aortic valve and mitral valve, and 99% left main coronary artery stenosis. But he did not survive after coronary artery bypass grafting. Latency may be long in RICAD, with patients presenting decades after radiation exposure. Manifestations range from asymptomatic perfusion defects to triple vessel disease and even sudden death. Though involvement of the coronaries may be diffuse, a preference for proximal involvement is often noted. Inflammatory plaque with high collagen and fibrin content is seen pathologically. Partial prevention may be achieved by aggressive management of conventional coronary risk factors, best initiated prior to radiation therapy. Special investigations considered are stress echocardiography, myocardial perfusion imaging, and computed tomographic CT coronary angiography. Higher rates of graft failure, perioperative complications, and all-cause mortality are associated with coronary artery bypass grafting in RICAD. Coronary angioplasty with drug-eluting stents may be the preferred option in the management of RICAD in most cases. First set of journal references. Second set of journal references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.